Good day, my name is Royce Bumagat, and we are the Group 2 presenting to you our BE project. And the topic that we are talking about is cardiovascular monitoring. And I am assigned to explain the application of this topic. Now, let's get started. A lot may be learned about the effectiveness of medications, lifestyle modification, and other treatments by monitoring your health with applications that measure your heart rate, blood pressure, fitness, and endurance. Keeping track of your KPIs or key performance indicator can also help you and your healthcare staff have more fruitful and precise interactions. And now, let's move on to the example of application in cardiovascular monitoring. I will share screen first. Now, we have a instant heart rate. This also can be seen in the application in Android, also in iOS. In less than 10 seconds, the instant heart rate converts the camera on your cell phone into a heart rate monitor. This instrument is known a favorite of cardiologists and researchers due to its accuracy. Take the easy test while seated to record your heart rate and get a graph of your pulse waveform, or use the app Stands Up Exam to gauge your level of fitness and weariness. The software keeps track of your beats per minute and offer a place for notes so you can keep track for trial activities. This also measures your pulse rate and heartbeat zone accurately with your heart rate and health monitor after sleeping or during workouts and training. Instant heart rate doesn't require a heart rate straps. Instant heart rate functions similarly to pulse oximeters, detecting the change in your finger to provide accurate heartbeat measurements. Next, we have Pulse Point Response. This app can call Pulse Point Response that connects to 911 and also can notify you immediately about emergencies in your neighborhood and ask for assistance when CPR is required. A culture of action and a crucial tactic in bolstering the chain of survival for cardiac arrest victims is driven by an informed and involved community that Pulse Point assists in the building. You can select You can select to be informed of important events that might affect you and your family in addition to nervy CPR needed or messages. These alerts about local dangers like wildland fires, flooding, and utility issues give people a head start. Most Pulse Point connected communities even allow you to view live dispatch radio activity by tapping the speaker symbol. And lastly, the blood pressure tracker app. This simple program offers a long-term calendar so you can monitor your blood pressure over time. Unlike other apps, blood pressure tracker helps you to track your levels to get a complete picture of your health without measuring your heart rate, unlike this picture here. And now, to provide your doctor a complete picture of your heart health over the short and long term, look at your systolic and diastolic readings, your pulse, your weight, and to share and understand your data quickly. You can export in popular formats like Excel or PDF. So that's all with our PE project. Thank you.
Good day, my name is Reynard Canto and I'm here to present how does cardiovascular monitoring work and what are the types of it. So cardiovascular monitoring is regarded as a standard procedure for identifying cardiac arrhythmias and it is useful for assessing and monitoring drugs and their impact on the health of a patient. Although each type of monitor differs from others, they all feature electrode sensors and that record your ECG. So the sensors require a solid skin contact, or contact can lead to a subpar outcome. The gadget can be worn on your wrist, carried on your hand, or be kept in your pocket. So wearing an event monitoring is possible for weeks or until symptoms appear. For monitoring services, they keep a close on contact to the patient who have signed up for their services and send their findings to a physician for diagnosis. Those who sign up for the service frequently have palpitations, fibrillation, atrial flutter, syncope, or a variety of other heart rhythm irregularities. For event monitoring, the monitoring service continually receives and monitors the patient ECG when the patient is using a mobile cardiac telemetry device. So the monitoring clinician will notify the doctor under the signed notification criteria if any irregularities manifest itself. And for the Holter monitor, it is a specific type of carry-on electrocardiogram that while you're away from the doctor's office, it constantly monitors the heart's electrical activity for 24 hours or longer. So the data entered into a secure server, examined and evaluated by monitoring service before being forwarded to a doctor's for a diagnosis. That is all for how does the cardiovascular monitoring works. For the type of cardiovascular monitoring, a loop monitor is that the electrodes remain attached to your chest and the monitor constantly records but does not save your ECG. So when you feel symptoms, you press a button to activate the device. The device will then save the ECG shortly from before and during and for a time after your symptoms begin. Some event monitors start on their own if they detect abnormal heart rhythms. For a symptom event monitor, this device records your ECG only when a symptom occur, not only before they occur. You can carry this device in a pocket or wear it on your waist. When you feel symptoms, you turn on the device and place the electrodes on your chest to record the ECG. And for the patch recorders, this monitor does not use wires or electrodes. It continually monitors ECG activity for 14 days using an adhesive patch that sticks to your chest. And lastly, for implanted loop recorders, this is a small monitor that is implanted under the skin of the chest. It can be left in a place to monitor heart rhythms for 3 or more years. So that is all for the types of cardiovascular monitoring.
Hello and good day. My name is Michael Vincent Artumaliwan, and I'm a representative for Group 2, which tackles the cardiac monitoring systems and devices. So, for my part, I'm going to discuss primarily the advantages and disadvantages of these kinds of devices. So, a quick run through. These are a few of how a cardiac monitoring device looks like. So, there is this wearable monitoring, implanted monitoring, bioelectronics, assisted therapy, and there's also cell therapy. So another form of wearable monitoring is smartwatches. So let's talk about now the advantages. So there are five that I'm going to mention, but before on that, let us tackle why is that cardiac monitoring or telemetry technology is very important. Telemetry technology allows doctors to monitor their patients, especially if it's to identify patients who require urgent intervention from those who had these benign conditions who can be just discharged home. So another thing is that it allows doctors to monitor your heart's electrical activity for an extended time. This will help also for them to diagnose if there are any problems with how your heart beats. So going now directly to the point, the first advantage is that it provides the doctor and you yourself a heads up. So basically, these monitoring devices will give you a note early notice or early detection of what can possibly happen or what can possibly be wrong with your heart. So they offer the potential to catch heart problems early on. So the second is the maximization of healthcare workers' time. So maximizing the health workers' time is allowing them to work simultaneously, not one by one. So what happens is that in with the help of telemetry technology, it allows doctors to monitor multiple patients without sitting with them one by one. So basically, the work is fast and then they can almost catch up to the speed of the machine in terms of diagnosis. And saving up money. On-site telemetry eliminates the need for extra staff who requires hourly pay. And off-site telemetry even saves more money for both patients and insurance companies. So you can receive your own telemetry monitoring through these devices called smartwatches, in which you can install these features or applications from your watch to your smartphone. So, in terms of detecting discomfort, telemetry communication can signal a healthcare professional that the patient is experiencing serious pain. So, a good example is that when somebody is ill, um, what happens here is that it sends them right away a signal if this is an implanted um, cardiac monitoring device. And also, it gives the patient a peace of mind because somebody can constantly see their electrical heart signals, and also they themselves can see it for them. um they can feel safe spending time alone and falling asleep. Basically, what happens here is that having the power to monitor your own condition will give you a slight edge in terms of the mental game against maybe a slight heart problem or a major heart problem, because you can monitor yourself if something's wrong with you. And then for the disadvantages, devices like 24-hour Holter monitoring is likely to miss most of the PAF. And depending on duration of the monitoring, it is likely to miss a fraction. And poor patient compliance may decline with increased monitoring durations. Devices like mobile cardiac telemetry are relatively more expensive. These disadvantages or limitations are most likely focused on the marketing side, making it very expensive. And lastly is the insertable cardiac monitors. They also need to define long-term pathways for data gathering. And also, this is the most expensive out of all the types of cardiac monitoring devices. And lastly is the for the smartphones, um, bugs or computer bugs can be experienced during the monitoring. So what happens here when the smartphone detects something, it could detect false positive outcomes, which causes anxiety and relentless checking of the patient in terms of relentless checking of heart rates on the patient's end, which causes them anxiety. So I guess that's it for my part, and thank you.
Good day, everyone. My name is Carl Martino Lucas Calyang, and this is Group 2 from B101. So this is a continuation of Mr. Michael Tumuluan to discuss of advantage and disadvantage of cardiovascular monitor monitoring rather system. So I have five types of monitoring technology, and I'll tell you what is the advantage of disadvantage of this. So first is a Holter, a 24 hours Holter monitoring. So what is a Holter monitoring? So Holter monitoring is uses electrodes and recording device to track the heart rhythm for 24 to 72 hours. And this also a healthcare provider can be printed a electrode diagram stripes using the data of the recording device to see the heart rhythm during the period the monitoring was worn. So what is the advantage of this? This is inexpensive. This is a cheaper value of device to monitor. And the disadvantage of this is likely to miss most of PAP and external leads. So that is the 24 hours holdering. So let's next this one. Next one is a ambulator event monitor. This is also inexpensive. Then the disadvantage of this is depending on the duration of monitoring, likely to miss the significant fraction of PAF. Secondly, the external leads as also same as Holter monitoring. And lastly, this is poor patient compliance that may decline rapidly with the increase of monitoring duration. This where the heartbeat increases without any significant reason while you're sleeping. Maybe you get cardiac something, then this will not work. So what is the explanation of this one? So ambulator electrical monitors are devices that can only record the electrical activity in your heart over the long period of time. You can take these monitors home with you and wear them for a days or weeks or even years. But there is the disadvantage of this, like I mentioned a while ago, this is a for patient compliance that may decline the rapid increase because maybe this is a maybe you get for in real life you may exercise, then maybe the rapid of this is intense like that. So nextly is the patch monitor. Uh this is a patch monitor, or we can call it a CAM-TM patch heart monitor. It's a lightweight wire-free monitoring device that continuously records every heartbeat and enable you to note when you feel symptoms. So patch monitor is continuously intermediate term monitoring is possible. Then, secondly, the advantage of this is minimal obstructive for external device. Well, this is a tolerated than the 24 hours halting monitoring, then the ambulator event monitoring. Then the disadvantage of this is a relatively more expensive because this is a wireless free, then you can bring everywhere. Then, depending on the duration of monitoring, likely to miss a significant fraction, like the two, the two technology that I mentioned a while ago. Then, lastly, this is extended monitoring may require one or more one or more batches. So, next here is a mobile cardiac telemetry or MCT. So, what is MCT? It's the most advanced cardiac cardiac monitoring that someone is monitoring 24/7. Who will right away get contact with your physician if there are any abnormalities. We all know each of one don't want to go into hospital because if we go in hospital, there are maybe we get sick like that, but we must prevent going to hospital with this mobile cardiac telemetry. We can observe here if we have symptoms, we can feel abnormality with our situation. This can help us. So, what is the advantage of this? The continuous intermediate term monitoring is possible. Rapid response, develop clinical situation. Then, the disadvantage of this is really more expensive. Long-term monitoring cost relies on the external leads and may be associated with the poor patient compliance. That's why I mentioned this is more expensive. That's why some of people don't want to avail this one because lack of funds. Not to harm, but this is the reality. So lastly is the insertable cardiac monitors. So the insert cardiac monitors is a small implant device that continues monitor heart rhythm and records them automatically or when you use a handheld patient activator. So the disadvantage of this is a totally no extreme wires, but this is a 100 compliance. The advantage is patient convenience. This is a provide the long-term continuous monitoring in at least 3 years. Rapid response to develop clinical situation. Then the disadvantage of this, let me show this one. This one, the St. Jude Medical Confirm RX or the implant cardiac monitors. And the disadvantage of this is need for minor incisive produce, need to define long-term pathway for data analysis and management. Most expensive cost of device and implementation, it will well production. Long-term monitoring incurs. Why this is expensive? This is must include a operational to implant that device. So I hope you get some information from me. Then see you soon.
Good day. I will now be presenting the examples that is currently marketed for cardiovascular monitoring. So the types of devices will be split into two parts, temporary monitoring and remote monitoring. For the temporary monitoring, the first product will be Biomonitor 2. Basically, it is to detect an abnormal heart rhythm. Biomonitor 2 can detect and diagnose with precision atrial fibrillation, ventricular tachycardia and fibrillation, and syncope. Because it is MRI compatible, it will always have access to the most advanced imaging technologies available. These implants are also inserted beneath the skin and minimally invasive process. It can be bought online in their own company name, biotronic.com. That is also recommended by the doctors. The second product for temporary monitoring is Zio XD patch. Detecting abnormal heartbeats is made easier with discrete wireless patch. It can be used during everyday activities such as sleeping, showering, and exercising without any discomfort. Zio has no wires and may be easily concealed under clothing. There are no incisions required to install it on your chest. It is available online and can be ordered in their website, iRhythm or iRhythmtech.com. Also one of the global teams that makes cardiovascular monitoring devices. For remote monitoring, the first product that will be presented is Biotronic Home Monitoring. People that have cardiac monitors, pacemakers, implanted defibrillators, or cardiac resynchronization treatment devices can rely on Biotronic to provide around-the-clock monitoring. Biotronic Home Monitoring monitors your heart, rhythm, and function, as well as the performance of your implanted medical device. and alerts your healthcare team to any changes in your health or device condition. There has never been a mobile phone-based remote monitoring service that provides automatic, reliable follow-up care or implanted devices. You can purchase it via biotronic.com, which is also endorsed by the doctors. For the last item, for remote monitoring is CardioMEMS HF system. If you experience heart failure, CardioMEMS can help your care provider monitor your symptoms while you are at home. Pulmonary artery pressure and heart rate are measured by an implantable wireless sensor that is inserted into your body so that your heart care providers can make appropriate adjustments to your medications. Also, you can avoid unnecessary visits. On their website, cardiovascular.abot, it is available for purchase and may be customized to your specifications. In addition, it is also one of the world's leading manufacturers of cardiovascular monitoring devices. In addition to other cardiovascular monitoring devices marketed, ECG or electrocardiography is one of the most common devices for tracking our heartbeat and rhythm, currently available in hospitals, cardiac centers, or directly to the company that is available online. Some other devices are smartwatches like Apple Watches that can be held to monitor our heart rates, available to any malls or any store in our country.